Many parents, caregivers, adults get really nervous and anxious and kind of scared. Like, how do I talk to my kid, my teen, about suicide, thinking about hurting yourself, wanting to die? And it gets awkward and you don't know what to say and you're scared you're going to say the wrong thing. And the reality is that if we don't bring up the conversation, we can't have the conversation. It's difficult to know when to start talking about mental health issues, suicide, depression, anxiety. I think that sometimes kids are exposed to other medical conditions like cancer or heart attacks sooner. And we kind of shy away from talking about mental health and depression and what happens when individuals suffer from depression and what suicide even is. And so I think that it's figuring out, how do I open the conversation early on to let my kids know that there's a lot of different things that people struggle with, because we don't want to have stigma. We don't want to shy away from talking about sadness or worry or these thoughts. And a lot of times that fear comes from wondering, if I bring it up, will it make it worse? And will it make the kid think more about suicide or actually complete suicide? And what we know from the research is that when we talk to people at risk, people that maybe have been struggling or have thoughts in the past, it doesn't increase the rates of suicide. It doesn't increase their thoughts of self-harm. So when somebody's thinking about it, actually talking about it with somebody helps them feel less alone and more connected. I think that a lot of people have different thoughts. And so some may think, I just don't want to wake up. Some may think, I want to hurt myself. Some may think, I want to kill myself. And so maybe sometimes saying it a couple different ways can help, connect with the person. The most important thing to do is, if you're concerned or you're wondering, is to ask. And then it's probably, what do I say? How do I say it? What are the perfect words? And you might stumble over the words, right? But the important part is that you care, that you're concerned. Sometimes we wonder, what are the warning signs to know, is my kid struggling? You get to know your kid and you kind of know when something's kind of not right? They're maybe not acting the way they normally do. They're being more aggressive or irritable or sad, or they're isolating a lot or not interested in doing the things they usually like to do, or not wanting to be with the family. Those are all kind of signs that something's up, right? And so when we notice differences, it's important to kind of observe and then kind of look into it. So maybe say, you don't seem like yourself today. Is everything okay? Like, what have you been thinking? Is there anything bothering you? And if that continues, those changes continue, that could be a sign that maybe they're struggling with depression or anxiety, or maybe they have had a traumatic experience that you don't know about. So then it's kind of like, well, what do I do when they say, yes, I want to die? And I think for caregivers, that's a very scary moment. And when you're about to ask the question and you know that there could be a yes involved, that brings up a lot of emotion, a lot of fear, anxiety. And when we have fear and anxiety, our emotions kind of get dysregulated, right? And so when we're going to have that kind of conversation, we need to make sure that we're kind of regulated and calm as we can be. And remember that in that moment when we're trying to connect with that youth, that we want it to be about where they're at and be able to be attuned to their emotions and their needs and regulate our own emotional response so that they don't feel like they have to take care of us. And so being calm and then validating. So what I mean by validating is attuning yourself to what are the emotions. So think about how scared that kid or teen may be. They're having these thoughts. They're worried about having this conversation. They've started to have the conversation, but it's really scary. And so being able to say something like, I'm really proud of you for being willing to have this conversation with me. That must have been really hard. And it must be really scary to be having these thoughts and feel very alone and worried about what I'm going to think, what others are going to think, worried about what we're going to do next, and kind of validate some of those common thoughts or worries or feelings that you may expect somebody to have. And so that individual feels heard and validated. And so it's important not to move really quickly to problem solving. So very often as a parent, caregiver, you want to fix things, right? You want it to get better. And actually, when we're trying to connect, we need to make sure that we're present with what's going on, and attuned to those emotions and the fears. And so if we move too quickly to problem solving, then we're kind of being dismissive, right? We are not focused on where that person's at and what that teen may need from their caregiver. And so maybe asking some questions to try and figure out, where is that person at? Are they just having kind of thoughts? So you may say something like, what have you been thinking? What are some of the ways that you have been thinking of hurting yourself? Have you thought about doing anything? Have you made any plans? So you kind of get an idea of where they're at to figure out, okay, how do I proceed? Like, what do I need to do next? Like, is this a crisis moment right now? Have they taken pills? Do I need to call 911? Do I need to call for advice of kind of what the next step is? And so kind of being calm and not asking like too many questions too quickly, and remembering to validate. So if you're asking like, have you had these thoughts and what thoughts have you had? That's really scary to be having those thoughts and to be thinking about a plan. So remembering to come back to that emotion. Once you have an idea of kind of what your concerns are, then identifying, okay, do we need to act right now? And if you don't need to act right now, in terms of calling 911, it's figuring out, okay, how do I keep them safe? Part of suicide prevention is securing lethal means, sharps, medication in the home to try and decrease access and kind of create barriers. And then kind of figuring out like what can help them feel also emotionally more safe in the home. And so does the person need a mental health professional? Do they need to talk to somebody? If they've got a mental health professional, do they need a session, or would mobile crisis be helpful? And so calling 211 or the suicide prevention hotline can help you navigate some of the, what to do next in that moment. So after a crisis, or when you first hear about your, child is struggling, it's important to not just have that one conversation and then not talk about it again. And so figuring out, how do I keep that connection? How do I keep that follow-up? Maybe that looks like a text message check-in once or twice a day. A lot of times teens don't want to talk, but maybe they'll answer a text. And so maybe working with a mental health professional to figure out, how do we communicate, right? Even if the teen is saying, I don't want to talk to you about this, it's a safety issue, right? And you want to make sure that they know that you care. So going to the ER because of a concern of safety, so worrying that your child's not going to be able to keep themselves safe or you can't keep them safe, is a really scary thing. We don't often know what to expect. We don't know how we're going to be treated. We're also scared and concerned about our child. And so knowing that, that is a normal reaction to doing it. And just because you're scared of it doesn't mean you should shy away from it. And so going there knowing that, okay, it's okay that I'm scared. It's okay that I don't know what to expect and I don't know what's going to happen. But I know this is important. It's really important to act when there's a serious or imminent concern. So once you're at the hospital, there's going to be a lot of questions and interviews and kind of determining, where is the kid at? What is their safety concerns? What is their risk? And figuring out whether they can make a safety plan and whether the kid can, through conversation and doing a safety plan, return home, or whether they need to go to an acute facility to kind of help stabilize, or whether a partial program, which is kind of like a day program where you go for the day and you have different group treatments, would be appropriate. So they kind of do an assessment to figure out what kind of level of intervention is needed right here. When you start to kind of notice changes is to figure out, okay, can I have the conversation to figure out if if they'll talk to me. And if they do talk or they don't talk, figuring out, who else can I bring on board here to support this, whether it's the doctor, a mental health professional, a teacher, school counselor, an aunt. I think it's important to remember, like, if your kid got cancer or you got cancer, you would, lean on your support systems to support you in this. And when people struggle with depression, anxiety, we tend to not talk about it, and we don't lean on our support system because it's not okay to talk about that. And so I think it's important that we're open with each other and we can support each other, and that's how we kind of break the stigma on that too. So a lot of times when a parent's concerned, they want to have their kid go to counseling or therapy, and there's a lot of resistance to that, right? Because you don't want to talk to someone you don't know. You don't want to be going in and spilling your guts and being vulnerable with somebody you don't know and you don't trust. The most important thing to do is to try and find somebody, and then also be in tune to whether the kid or teen likes the person. Because it's important for that therapist to work on building that rapport, building that relationship, and building that trust. And that does not happen in the first session. And so sometimes talking to your kid about, like, I really want you to have the support that you need. And I don't always know the things to say or how to talk with you. And I think it's important for you to have somebody safe to talk to. And so can we try it a few times? Like, can we try it 3 or 4 times? And kind of start off with a time-limited commitment so that they know what to expect. And if they still don't like the person, then they're going to maybe try somebody else. Because not everybody gets along, right? Different personalities, different styles. And so I really encourage parents that help your kid find a therapist they like, they connect with, they feel safe with. That is possible. That is really possible. I've had a lot of kids and teens in my office not want to do therapy and can change the course and really engage and complete successfully their treatment. And so sometimes you just got to stick it out in the beginning and give it a chance. When your kid struggles with depression, anxiety, suicide, or other mental health issues, that can feel like you did something wrong. Like, I wasn't a good enough parent, or I'm a failure as a parent, or I should have done this and I should have done that. If I had only done this, then things would be better. We kind of try and search for a reason why this is like it is, right? And what we did to contribute to it. But it's important to know that this isn't your fault. Suicide, depression, anxiety is not your fault, and that we have to figure out how to support our kids and help them get the resources and the treatment that they need, and focus on action and validation, and not on, what did I do wrong? How do I fix this? It's here. It is what it is. And we have to take where we're at and figure out a way to support and hold hope and find the resources and treatment that's needed. We want to help kids and teens to feel valued and loved, and that they're important, and that their life is important, and their future is important. A lot of times when kids have struggled with depression, anxiety, or have experienced trauma, they have a hard time thinking about the future. They have a hard time believing that they can achieve something. And so having conversations about the future, encouraging them about the future, is also really valuable, because that helps them to think about their life.